Welcome to The Explainer. Today, we're diving into the incredibly high-stakes world of anesthesia for major vascular surgery. This is where medical teams are literally working on the body's biggest pipelines, all while keeping the patient perfectly safe.
I mean, think about it. How do you actually do that? It's an incredible challenge that surgeons and anesthesiologists face every single day. Answering this question pushes the absolute boundaries of medicine, and it requires this delicate dance of skill, technology, and a really deep understanding of how the human body works.
So here's our game plan for today. We're going to take a journey through the body, starting with why vascular surgery is such a high-stakes world. Then, we'll look at how teams guard the heart, protect the brain, preserve the spinal cord's lifeline, and shield the kidneys. And finally, we'll see how the anesthesiologist's art brings it all together.
To really get this, you have to stop thinking of the anesthesiologist as just the person who puts you to sleep. They're more like mission control. They are actively managing every single vital organ system while it's under the extreme stress of having its main blood supply clamped off.
And this right here is probably the single most important takeaway of this whole explainer. Success isn't about some magic drug. It's all about keeping things stable. It's about maintaining what's called stable hemodynamics, steady blood flow and pressure, to make sure every organ gets the oxygen it needs to stay healthy.
Okay, so our first stop is the heart, the engine, right? And during these surgeries, it is immediately put under a ton of pressure, mainly because the patients who need this kind of surgery, well, they often have heart problems to begin with.
The numbers here are pretty mind-blowing. Fewer than 10% of these patients come into the operating room with completely normal coronary arteries.
And it gets even more serious. More than half, that's right, over 50%, have advanced or severe coronary artery disease. So this isn't some minor risk. This is the starting point, an incredibly high-risk baseline that the team has to manage from the very first second.
Now here's where things get super interesting. A huge study called the CARP trial found something that kind of goes against common sense. You'd think, hey, if the heart's arteries are clogged, let's fix them before this big surgery, right? But the evidence shows that doing that preemptively, putting in stents or doing bypasses, doesn't actually improve the outcome.
So instead of another big invasive procedure, the focus shifts to just rock-solid medical management. It means keeping patients on their medications like beta blockers and statins. And then, during the surgery, it's all about meticulously controlling heart rate and blood pressure to balance the heart's oxygen supply and demand. They use monitors to keep an eye out for any sign of distress.
All right, next up, the brain. Let's talk about a procedure called a carotid endarterectomy. This is where surgeons are literally cleaning plaque out of the main artery that supplies blood to your brain. And when they do this, the brain faces two huge threats at the same time.
On one hand, you've got hypoperfusion, not enough blood flow. When that artery gets clamped, blood flow can drop to dangerous levels. On the other hand, the very act of cleaning the artery can break little pieces of debris loose, creating an embolism. And where does that go? Straight to the brain, which can cause a stroke.
So how do you manage that? Well, this is where sophisticated, constant monitoring is absolutely crucial. The team is watching brain function the entire time to make a critical split-second decision. Does this patient need a temporary bypass tube called a shunt to keep blood flowing while that clamp is on?
And this brings us right back to our main theme. The huge GALA trial looked at over 3,500 patients and found that it really didn't matter if the patient was completely asleep under general anesthesia or awake with a local. The reason is that what actually matters is monitoring the brain. And what's the best monitor for an awake patient? The patient themselves. You can just talk to them. It proves once again that smart management is more important than the specific technique.
And that brings us to what is maybe the most feared risk in all of surgery, especially when operating on the thoracoabdominal aorta, that giant vessel running down your chest and belly. The risk is paraplegia, paralysis of the lower body.
This entire terrifying risk all comes down to one critical, tiny but mighty vessel, the artery of Adamkiewicz. It's basically the main highway of blood for the lower two-thirds of the spinal cord.
But here's the problem. Its location is a mystery. It can branch off the aorta anywhere between the 9th and 12th thoracic vertebrae, sometimes even higher or lower. So, if a surgeon clamps the aorta, and they happen to clamp above where that artery branches off, they've just cut the blood supply to the spinal cord. It's a catastrophic problem that demands a multi-part strategy to prevent it.
So the defense is a three-part system. First, they can drain some cerebrospinal fluid to lower the pressure around the spinal cord. Second, they can use a bypass to pump blood to the aorta below the clamp. And third, they use what's called protective hypothermia. They actually cool the patient down.
And of all these strategies, cooling the patient is maybe the most reliable protection they've got. It works by slowing down the body's entire metabolism, so the nerve tissue just doesn't need as much oxygen. It's incredible. Even just mild cooling to 34 degrees Celsius can double the amount of time the spinal cord can survive without blood flow.
All right, moving on. We get to the kidneys. They are also super vulnerable to any drops in blood flow. And interestingly, as our surgical techniques have become less invasive, we've actually uncovered a whole new set of challenges.
So, what's the single biggest thing that predicts if a patient's kidneys will fail after surgery? It all comes down to how well their kidneys were working before they even got to the operating room. That preoperative condition sets the stage for everything else.
And you can really see how things have evolved. With old-school open surgery, the big worries were massive blood loss and huge shifts in body fluids. Now, with modern endovascular repairs, we've traded those problems for new ones, like endoleaks, where the graft doesn't seal perfectly, or the device itself actually migrating over time.
So how do you tie all of these different strategies together, protecting the heart, the brain, the spinal cord, and the kidneys all at the same time? Well, this is where it all stops being just science and really becomes an art.
And that brings us right back to where we started. This quote sums up the entire philosophy perfectly. It's not about the drug. It's not about the technique. Maintaining stable blood flow to those vital organs is way more important to the final outcome than anything else. Stability is everything.
The real art is the anesthesiologist acting as the conductor of a symphony of interventions, guarding the heart, perfusing the brain, protecting the spinal cord, shielding the kidneys, all at once. It's this incredible, real-time balancing act that defines modern anesthesia. And it leaves us with one final thought. As patients get older and these repairs get even more complex, what's the next frontier going to be?